Nelson, we can go anytime? Or do you want to wait? Okay, thank you. Yep.
Well, good morning, and thank you all for coming. My name is Jean Lewis, and I'm the parent of a child with autism, and I'm also the founding director of FEAT, Families for Early Autism Treatment of BC. We're all going to make a few brief remarks this morning, and we'll be happy to take questions after. David Marley and I were here on behalf of FEAT, which is a 100% volunteer organization of parents and professionals who sought Medicare coverage for autism treatment over the last 10 years. We're here today to represent FEAT and to talk about the issue of Medicare, but I'd just like to start by saying that today in North America, autism is an epidemic of staggering proportions. The Center for Disease Control in Atlanta is now saying that 1 in 150 children and 1 in every 94 boys are now being diagnosed with autism. Now in Canada, Medicare is over 40 years old, and the Charter is 25 years old. And it is no longer acceptable that these children remain orphans of our Medicare system, and compassionate, fair-minded Canadians agree. It is only the political class and the health technocrats in Canada who continue to oppose the morally right thing to do. It is now beyond debate that ABA, or Applied Behavioral Analysis, is the most effective science-based treatment for autism. It's been tested repeatedly in the crucible of litigation and science, and the courts have found that this is medically necessary treatment. As a matter of fact, the BC Court of Appeal in Ottawa found that autism is a socially constructed handicap, and it can be overcome with treatment. Now, some ask, how much does this cost? Well, the real question is, how much does it cost not to treat? Harvard University last year did a study that reported in Canada we spend $3.5 billion a year to maintain the status quo, which is nothing. That does not include treatment for autism. We also know through cost-benefit analysis that conservatively we would save $1.2 million over the lifetime of one child. But the cost in human suffering is not to be measured. The negative externalities, 75% of marriage breakdowns, single mothers, siblings, the loss to our society is enormous. But speaking of costs, nobody asks the costs, how much does it cost to treat diabetes, or cancer, or HIV? The question of cost remains when it comes to these children. Why are our children not worthy of treatment? The courts and an overwhelming body of scientific evidence have ruled that ABA is best practices. This is our third trip to Ottawa in the last 18 months. In November of 2006, I attended a rally on Parliament Hill in support of Medicare coverage for autism. I also appeared before a Senate committee focused on how to best provide funding for the treatment of autism. During this visit, I introduced FEAT's political strategy, or the 2% solution, which was very effective in British Columbia during the last federal election campaign. You're going to hear more about that in a few minutes from David Marley. Last May, we returned to Ontario, had a press conference in this room to announce our FEAT BC Goes Coastal campaign, which have extended the 2% solution to ridings in Ontario and the Maritimes. Our political initiative to obtain Medicare coverage for autism has gone national. Besides unveiling it here in Toronto, we traveled to Halifax, had a Medicare for Autism rally in Halifax with about 150 supporters. Senator Munson, Sean Murphy, Peter Stauffer and Andy Scott all attended the rally. Unfortunately, Senator Atkins was unable to attend at that time. But today we're back, principally to meet with and organize parents, supporters, and other fair-minded Canadians to teach and train them how to engage in the next federal election campaign by making their vote count. by supporting candidates, regardless of party affiliation, who will publicly commit to amending the Canada Health Act to include autism treatment under Medicare, thereby ending the discrimination and finally providing universal accessibility to every Canadian afflicted with autism. Over the next 3 days, we will be making a campaign swing through our federal health minister's riding. We'll be meeting with local media and community leaders, sharing this story, and most importantly, eliciting their support, which we're confident we will get, because in 2004, Ipsos Reid did a poll, and they found that 89% of Canadians said that this treatment should be included in Medicare. It's quite a disconnect between the people and the people who govern us. We'll conclude our week in Toronto meeting with supporters and various media. And we have a Medicare for Autism Now rally in Oakville on the 19th at the Iroquois Rec Centre at 2 o'clock. On March the 2nd in Burnaby, in British Columbia, we had a Medicare for Autism rally where 400 people attended. 25% of the attendees were not parents of children with autism. They were concerned Canadians who want this fixed. Autism has become an election issue in the U.S. In 2006, the Combating Autism Bill, which allocated $945 million to treatment and research, was unanimously passed. Presidential candidates Obama, Clinton, and McCain have all publicly stated extremely progressive positions. Meanwhile, in Canada, all we hear from our federal government is, it's a jurisdictional issue, it's up to the provinces. Let me be clear. Parents of autistic children and growing numbers of supporters expect this to be done. This is a reasonable expectation. We are no longer prepared to appear before governments as supplicants, those only to be met with more political indifference. Those days are over. Our question is, will our MPs summon the necessary political will to overrule the entrenched health technocrats and do the right thing? If not, we have a problem. The solution will be to elect some new MPs, ones who are made of different stuff. And speaking of different stuff, I'd like to take this opportunity to recognize some parliamentarians who have distinguished themselves by actually doing something to move this cause along. First, Senator Munson, who's been very active in the last certainly 3 years. Yes, Sean Murphy from Charlottetown, who tabled Bill C-304 last year, which was a private member's bill to amend the Canada Health Act to include autism treatment, and Andy Scott, who tabled a motion, a year ago? 172. Motion 172. So thank you. Continue. Now I'd like to introduce our next speaker, who is Stéphane Marinoux. Stéphane is the parent of Simon, his 15-year-old son, who is severely autistic and has never had intervention or treatment. Now, you should know that out of desperation, last February, Stéphane walked from Toronto to Ottawa to raise awareness about the plight of children and their families. And I'm happy to report that he didn't have to walk from Toronto today, that Feet BC actually flew him today. So it's my pleasure now to introduce Stéphane.